Familial hyperchylomicronemia is an autosomal recessive disorder that's characterized by abnormally high chylomicron and triglyceride levels. In this video, we'll be attending a national chiropractic convention where we'll learn all about this disease. Let's get started. Welcome to this year's annual chiropractic convention, featuring the hottest new chiropractic gadgets and appliances in town. That's right, this convention center is jam-packed with chiropractors all looking to up their game. Let all these chiropractors anchor you to the disease familial hyperchylomicronemia. Get it? A lot of chiropractors for hyperchylomicronemia? They're the chylomicron chiropractors. Next, notice what's in this chiropractor's hand in the foreground here. It's the latest massage therapy gun, and they're debuting the new model at this year's chiropractic convention. Let this chiropractic gun remind you that familial hyperchylomicronemia is also known as type 1 hyperlipoproteinemia. It's the type 1 gun. Next, take a look at the small carts here. They must use these to cart around all the new massage oils from vendor to vendor. Anyway, these small carts should help you remember that familial hyperchylomicronemia is an autosomal recessive disorder. At Pixorize, we use small automobiles, like small cars and carts, to symbolize autosomal recessive inheritance, whereas large, dominant automobiles, like tanks and trucks, symbolize autosomal dominant inheritance. The small cart here should therefore help you remember that familial hyperchylomicronemia is inherited in an autosomal recessive manner. While we're here, I also want to mention that familial hyperchylomicronemia is really rare. This is at least partially explained by its autosomal recessive inheritance. Next, shift your attention to this chef over here. He's busy cooking up some new massage oils and creams for testing. From Melrose Sweet Almond Oil to Apricot Kernel Oil, this chef has you covered with all natural ingredients and the highest quality botanical properties. But oh no, it looks like whatever he's cooking has gone awry. It looks like his newest concoction has caught fire. The chef represents apolipoprotein C2. It's the ApoC chef. And the fact that he's on fire from a cooking mishap represents a dysfunctional ApoC2. That's right. Familial hyperchylomicronemia can be caused by homozygous inactivating mutations in ApoC2, which is a cofactor for lipoprotein lipase. And speaking of lipoprotein lipase, take a look at the butter knife in our chef's hand. Butter represents fat, so a butter knife must represent cutting fat, which is exactly what lipoprotein lipase does. With the help of its cofactor ApoC2, lipoprotein lipase cleaves triglycerides within the chylomicron, thereby releasing individual free fatty acids for delivery to the tissues. And yes, you guessed it, familial hyperchylomicronemia can also be caused by homozygous inactivating mutations in lipoprotein lipase. Notice how our chef was trying to put out the fire with his knife? Unfortunately for him, though, it looks like his knife is just melting over the fire. Next, take a look at the glass massage oils in front of the chef. He must have been preparing a fresh batch before his pan caught fire. These glass bottles of fatty oil are here to help you remember triglycerides, also known as triglycerides. They are here to remind you that familial hyperchylomicronemia is characterized by abnormally high triglyceride levels. Recall how ApoC2 and lipoprotein lipase normally cleave triglycerides into free fatty acids. Since familial hyperchylomicronemia is caused by a deficiency in ApoC2 or lipoprotein lipase, it should make sense that triglyceride levels will be abnormally high. Remember, triglycerides are the main constituent of chylomicrons. An inability to break them down means we'll have high levels of chylomicrons, and hence high levels of triglycerides. Next, take a look back at the pan that's on fire. This inflamed pan should help you remember pancreatitis, which is classically caused by high triglyceride levels. Since familial hyperchylomicronemia is characterized by sky-high triglyceride levels, pancreatitis should come as no surprise. Next, take a look at the chiropractor back at the front of the image. See the new chiropractic massage chair he's testing out? But wait a minute, the chair kind of looks like a spleen? Also notice the lever on the side of the chair. It must help the chair recline. Strangely, this lever looks a lot like a liver. It's the liver lever. Putting these symbols together should help you remember the finding of hepatosplenomegaly. Chylomicrons contain more triglycerides than any other type of lipoprotein, and high levels of them lead to the fatty infiltration of the liver and spleen, and this in turn causes hepatosplenomegaly. Speaking of excessive triglycerides, take a look at the body butter our chiropractor is holding in his hands. It's the latest and greatest body butter, and works great with the new massage gun. Isn't it really frothy and creamy looking? Yeah, this frothy, fatty layer at the top should help you recall what blood samples look like in patients with familial hyperchylomicronemia. That's right, blood samples can appear creamy, which is caused by the accumulation of fat towards the top of the test tube. Finally, let's talk about a more surface-level finding in patients with familial hyperchylomicronemia. I bet you've been wondering about all the body butter being poured on this guy's back. This fatty butter on the skin should help you remember the finding of xanthomas, which are just lipid deposits under the skin. When they are found around the eyes, they are termed xanthelasmas. This finding is fairly nonspecific among the hyperlipoproteinemias, but that being said, they're pretty common in familial hyperchylomicronemia. You specifically may see eruptive xanthomas, which are just xanthomas with an inflammatory component. Okay, that burning pan is really starting to stink up this convention center. Let's do a quick review before we call it quits. Familial hyperchylomicronemia, also known as type 1 hyperlipoproteinemia, is an autosomal recessive disorder that's characterized by high levels of chylomicrons. It is caused by homozygous mutations in lipoprotein lipase or its cofactor ApoC2, which together normally cleave and release the chylomicron's triglyceride contents. Since chylomicrons carry triglycerides, hypertriglyceridemia is therefore a hallmark of the disease. High triglyceride levels are also a common cause of pancreatitis, which therefore may also be seen. Other findings include xanthomas, hepatosplenomegaly, and a creamy supernatant layer in blood samples. Well, that wraps up this segment on familial hyperchylomicronemia. Now let's get out of here. I have to catch an appointment with my chiropractor.